Ready to shine inside out? Welcome to Polished Beauty Podcast, where ambition meets empowerment. We talk business, beauty, brain, body. I am your host, Dr. Daisy Ayim, triple board certified cosmetic surgeon and OBGYN. Let's get polished. Hey everyone, this episode is so exciting because I have with me a phenomenal guest. She has done some amazing things and I'm loving to chat with her. Welcome to board, Dr. Betty Murray.
Thank you for having me. Glad to be here.
Absolutely. So I don't even know where to start with you because you have so many great things under your sleeve. So we're going to focus on some cute things. The first thing, I know it's cute, but people don't think about it, but it really is. It's menopause, women's health, okay? It's cute all the time.
Yes. Yes.
So tell me about that space, because I know you're heavy in it. What got you into it, and what are some things that you've learned from it?
You know, what's interesting is I was in tech early on. So I was in tech in the 90s. So for anybody that's as old as I am, we remember the dial-up days. And it was through my own health problems that I ended up getting into healthcare. So, you know, I fast forward, I get into healthcare, I go back, get a master's in nutrition, start working with people nutritionally because I was diagnosed with an autoimmune digestive disorder. And at the time when I started taking nutrition classes, I literally got into organic chemistry and I'm like, ooh, this is it. Nobody ever says that.
Yeah.
But I like biochemistry. I like understanding how things work. And so I got out of school, you know, hang my shingle, start working with people and start helping particularly women with autoimmune conditions.
Yeah.
You know, and I started looking at it, I was like, gosh, you know, autoimmune conditions affect women 10 to 1 compared to men.
Correct.
IBS 3 out of 4. And then I entered perimenopause. And I actually went into it early. So I was in my late 30s. I'd had a tubal and no one said, hey, things could go wrong.
Yes.
And, you know, even while I was in sort of the functional medicine community, longevity community, I went through this very long, sort of arduous process of being told it was my thyroid, my adrenals, I was estrogen dominant, I was this, I was that. And my 40s were terrible. I'm 55 today, and they were terrible. And all I could think about was, if I'm immersed in the most forward-thinking group on the planet and I'm having this bad of an experience, what's happening for other women? So I went back to get another master's and a PhD not because I wanted.
She loves school, guys.
I just needed another $250,000 worth of student debt. No, I owned a clinic. I've owned a clinic for 20 years. We've been helping tens of thousands of women. But what I really understood was there was a big lack of science and there was nobody putting money and effort into it. And so I went back to understand hormone metabolism and, you know, how it impacts women, and particularly perimenopause and menopause.
Yeah.
You know, 50 million women are in perimenopause and menopause. 6,000 women a day go into menopause. And we spend well over a quarter of our life, if not a third of it, in menopause. But less than 7% are actually being treated appropriately with hormone replacement of a hormone deficiency condition that increases our likelihood of dying from all causes. And when I started really looking at that and then recognizing all the chronic disease that was made worse, I couldn't handle it.
Yeah.
And so this is kind of the hill I'm dying on because, you know, at the end of the day, women exist long after fertility because we are the wisdom passers to our communities.
Absolutely.
Right? Just like the whales. Just like the whales. It's the older moms, it's the grandmas that are out there making sure everybody knows how to feed. The reality is we need women because we're the wisdom drivers of communities.
Yeah.
And I look at that and I go, okay, I don't care what the Women's Health Initiative said. It was wrong and we need better research. And we also need to press the envelope of taking patriarchy out of medicine.
You know, I'm glad you mentioned some nuggets and some gems in this conversation because women's health, especially menopause care, is just lacking. You know, me being a board certified OBGYN, I can say loudly and clearly to anyone listen, I was not taught menopause care in my training. Yeah. I practiced menopause care because I took the initiative to learn it because I had patients that presented with it and I was like, what is that?
Yeah. What do you do with that?
Right. Yeah. And that triggered me to go in and want to learn it. So it's exciting to see what is changing with women's health and that. What do you think we need to do more of to get it going? Because I think there are loud voices there in the, you know, social media in different perspectives, but it seems like it's not loud enough yet.
Yeah, no, I would agree. I think most people would be shocked to know that OB gynecology actually, except for maybe about 20% of the schools, don't even have an hour of menopause training.
Yes.
Like, it's just missing. It's like something magical happens when you're no longer fertile.
Yeah.
And it's not your fault. You just weren't trained. So I think the challenge now is we have a 22-year history from the Women's Health Initiative that gave a false narrative that has made women very, very fearful of hormone replacement therapy inappropriately.
Yes.
And even though we have some very loud players out there, myself included, that are trying to get the information out, you're talking about a 20-year history of striking fear with propaganda, with massaging data and misrepresenting data to make women fearful. And so even though women hear it, I mean, we've been doing this for 20 years. We've literally been doing hormone replacement therapy for 20 years with bioidentical hormones.
20 years is a long
20
time.
years is a long time. Tens of thousands of patients. And you have a woman and they'll be like, okay, I've got it. I've heard all the research. I've read the books. And then they're still terrified.
Yeah.
And I think it's getting over the terror of misinformation and propaganda. Yeah. And I don't think we can say it enough. I don't think we can, get it on TV enough. I don't think we have nearly enough information to overcome that.
Yeah. I think you're very correct with that. The media needs to undo that. And unfortunately, they really weren't for us. But I think women now in the 40s and 50s, these women are different. They're not the women of our grandmothers' era. These women want to have great sex. They want to have a great life. They want to feel like they are amazing until the lights go out.
Yeah.
So we are speaking loud and clear that we want to see more of this, right? Yeah. So I like the fact that you've been practicing for 20 years because you came really with that WHI when it was hot and heavy.
Yeah.
And I remember when I was in residency, we were learning WHI as the Bible. That's what I was trained with. And then when I left or graduate residency, that's when everything sort of kind of burst, and then you have this decline of women and practitioners afraid of hormones.
Right.
How do you get a fellow physician, nurse practitioner, PA, anyone out there to not fear hormones and talk about it to their patient and implement it?
Yeah.
What sort of strategy would you give them?
I'd say, part of the luck of sort of the angle I came into medicine, because I came in as a nutrition and biochemistry major, I look at things differently. Like my entire world was like digging through research and reading the method and looking at how the actual statistical analysis was done. And I don't like statistics any better than anybody else, but it's important to know that, that the data was misrepresented. And, I was lucky enough that when I opened my clinic, I brought in healthcare providers that were open to looking at research and really okay, take the propaganda out, take the media message out, and look not just at the abstract, but all of it.
Yes.
Right? And so, a lot of it was, I tell people I'm the thinking side of medicine. I'm like, I don't treat. I'm a PhD, not an MD, not a DO, but because I come at it from that research standpoint, my job is to educate. And so, we started there with our practitioners and our patients, and now we've expanded and we have a telemedicine company that's expanding. And what I do see now is the practitioners are often much more interested, and especially it's two groups. Yeah. It's the female practitioners that just hit menopause and realize, oh, this stinks.
It's real.
It's real, and I don't have any tools, and I did a major disservice to my patients.
Yeah.
Right. So they're getting it, and then I think there's also the group that's coming out right now that they're like, wait a minute,
we need to know more.
We need to know more.
Yeah.
Because the reality is, the Gen X women we associate with J-Lo aging.
Yes.
Not Betty White.
Not Betty White.
Yeah, I'm
both
not
fabulous women, but we want J-Lo.
I love Betty White, but I want to feel and look like J-Lo.
Yes.
Until I get the grave.
Yeah, for sure. And it's really interesting because currently, with all the younger women that are approaching menopause, grandmothers don't look like grandmothers. The typical perception of what grandmothers did. And I would really poke at ACOG, which is American College of Obstetrics and Gynecology. Our tagline is excellent in women's health. That's our tagline. Is it excellent in women's health minus menopause? Because we don't have that in that education. And for my audience listening to this, some of them are patients, some of them are family and friends. When you're going to your OB/GYN doctor, we are known as women's health expert. And the expectation is to give that woman care in all sectors of her life. And a third of women are going to be in menopause before they die. So a third of your life is spent in your menopausal era. We need to have more information. So I'm really grateful that you have a platform. Tell me about your telemedicine platform.
Yeah, so the company's name is the Minerva Project. So for anybody that doesn't know Minerva, so Minerva was the spelling that we used as Etruscan spelling. So Minerva was the fully grown goddess that was born of Jupiter, right? So she comes out fully formed. She's the goddess of science, medicine, and war.
Okay.
And art.
Yes.
And art. We'll throw art in there. And the reason why we named it that way is we have to perpetuate science and medicine. And I think to some degree, women, we are at war to actually be heard and seen.
Yeah.
And so the telemedicine platform, we offer bioidentical hormone replacement, which means it's identical to the biochemistry that your body makes. So think of it as your hormone is a key. The key that your body made when you were 30, we just make it in a lab that matches it. It's like going to Lowe's and getting a new key that works perfectly in your door. And we replace what your body is no longer making. And we provide that in all 50 states. And so we have our providers that are trained to take a broader spectrum look at not just supplying hormones for hot flashes and night sweats. I have some problems with some of the societies like the Menopause Society because they're looking at hormones as a treatment for symptoms, right? And yes, hot flashes and night sweats are where most of the research was, basically spent. But the reality is all causes of death increase for women. All causes of long-term chronic health go up for women if they do not do hormone replacement therapy through the menopause window and onward.
Yeah.
Right. We have some really good observational studies and some really good retrospective studies looking at that. And so the other part of what we're doing with the telemedicine piece is providing science. So we are building and we're raising capital right now to build a technology platform that enables a woman from her phone to be able to start tracking her symptoms. And, we all wear wearables. I have every wearable ever known to man, and capture that data along with your symptoms. Because most women don't realize this, that when you have a hot flash in the middle of the night, your cortisol goes up, your body temperature goes up, your glucose levels go up. So if you're wearing all those toys, we should be able to normalize that and see it.
Yes.
So you can understand your body.
Absolutely.
And then we marry it with genetic data, your laboratory data, and then we treat based on all of that. Because just hot flashes and night sweats and saying if you don't have symptoms, you're adequately dosed isn't true. We have some studies showing that 50% of women will be underdosed and 25% will be overdosed with those generalized guessing prescriptions. So we're bringing the science to it, and then the goal being that we also capture how women are taking their hormones, because then we can act as a flywheel and create products and services for women's health and be a research platform on our own.
Guys, I told you she was amazing, didn't you?
This is where the nerd comes out. I'm nerdy. I can't help it.
I'm like, tell me more. A phenomenal. I mean, this is great. This platform is exactly what we need. AI is here. AI is the future, is the present. And the beauty of AI is what she just captured here, which is taking all the information that refers to you and give you the best solution for you. So I like that a lot, because why not capture all the different aspects, Besides the bioidentical hormone, do you guys prescribe for patients if they need like prescription, or is all strictly pellet?
So on the on telemedicine side, we do hormones, we do thyroid, we will do weight loss prescriptions and things. We keep our focus very focused on hormone health.
Okay.
And the reason being is we want to really create what's missing in medicine is we don't have hormone specific research on women. Even though we know hormones basically affect every single condition and every single medication that's provided. So we're keeping our focus narrow so we can do that. And we can be the support for other physicians and other clinical organizations that have maybe a broader scope of what they're doing.
Right. Absolutely. Yeah. This is good for us women. I mean, having more women, I think, that are in position to make decisions is how we're going to move the conversation forward.
Yeah.
Because for some reason, when it comes to women and what affects us, the needle doesn't move until you have someone in there that is feeling what they are feeling. Then they move the needle. Because I really think that's what has lacked all these decades. It's just not having women on the table, where these conversations are made, where these decisions are made. Therefore, our needs are not met appropriately.
No, I mean, if you look at it, so less than 2% of all investment dollars go to female-founded companies, despite the fact that female-founded companies outperform male-founded companies by 62%. Flash forward to C-level executives, less than 10% of any C-level executives are females, even though we make up a little more than 50% of the population. We're just not at the table, period.
We're not there.
And so the reality is there will always be bias in our healthcare. There will always be bias in our corporate experience. There will always be bias in every single thing, even down to your AI discussion. Because where do you think AI got its information? From biased information. So even that we have to work on. And so, I look at it and I think the women that are in their 40s, 50s, and 60s right now, we're the ones that are going to change the world.
Yes.
Right? We have agency, right? We have access, and we're probably a little bit angry.
Yes.
I am.
Yeah. I think, what was it? I was watching somewhere that said that the millennium moms are the ones that are telling, I don't like this. Change it.
Yeah.
The Gen X, which is my generation,
Yeah,
I think we're still, we are, but we still try to be formal somehow with it. But the millennials, they're not. Formality is out the window.
Oh, yeah, totally. I had a conversation with an investor, and one of them said, well, they're trying to extend ovarian age. And I go, well, that's not going to help anybody in Gen X category. And I said, and it's not going to help the elder millennials. And I can guarantee you they're not going to tolerate what anybody else is tolerating.
That's right.
They don't play that. They don't want to contribute. They don't want to contribute to insurance. They don't want to play with the conventional care model.
No.
They just aren't going to buy into it. And then the younger population behind that even more so on it.
Yes.
I was like, this whole industry must change because the marketplace and the people who spend the money are going to change it.
Yes.
And women, we make 87% of all medical decisions.
Yes.
So when someone says we don't have agency over our body, I don't know a single man whose wife or significant other doesn't make their medical appointments, their urology appointments, their cardiology appointments. The reality is we make decisions for everybody in the family, including our grandchildren.
Absolutely.
So we just need to know that we leverage that.
Yes.
That we can actually do that.
Well, we can. We can put our dollars where it matters. And we can speak up through our dollars. And we're doing that. I really like everything that you stand for and what you've accomplished so far. And in this podcast, I always ask every guest a question. Was that one bold thing or bold thought or bold decision that you feel has gotten you to this position that you are today? If you had to look back.
Oh my gosh, there's so many. I would say, for sure, probably one of my biggest ones is no is not an option. I don't hear no.
I like that. What do you hear? Tell us.
I hear that. I look at that and I'm like, well, that just means that I haven't figured out yes.
Okay.
And so I don't do no. No is not part of my lexicon.
I like that. We're not doing no, guys. We're hearing something else, but just not no. So that's amazing. How can they reach you for the audience? How can they reach you? Do you have a website or anything to tell us?
Certainly. So I have a podcast called Menopause Mastery. You can also find me at Dr. Betty Murray on YouTube and Instagram and Facebook. And then if you're interested in looking into our telemedicine company, you can find us at gethormonesnow.com.
I love that name. Get your hormones now.
Yes, exactly.
How did you come up with that name? Because it's so nice and catchy.
I was just like, what do women need? We need to be able to get hormones now.
Yes.
and you know what? The universe provided. They say, here's the .com. It's available for you.
I love it. Dr. Betty Murray, thank you so much for joining this podcast.
Thank you.
And guys, follow her on the Instagram, on YouTube, social media, and her platform, Get Hormones Now. If you need it, that's a resource that's available to you. As always, you can reach me, Dr. Aim. You know how to reach me, guys. So thank you so much for listening, and thank you for your time.
Yes, thank you. Thank you for having me.
Absolutely.
Yeah, wonderful.
I hope you enjoyed this episode, and thank you for listening. Video recording of this episode will be featured on our YouTube channel, Dr. Daisy Aim. We are also found on Instagram at Polish Beauty Podcast or at Dr. Daisy Aim. Remember, a new episode drop every Wednesday, so stay tuned. Please like, share, follow.